Annotated biography of research on Sudarshan Kriya Yog Sky in the treatment of clinical depression. Sudarshan Kriya Yog Sky, a breath-based meditative technique, has garnered attention for its potential in treating clinical depression. The following, annotated by bibliography, highlights key research studies examining the efficacy of Sky as a standalone or adjunctive therapy for depression, along with an addendum referencing its impact on clinical anxiety. Sharma, A. Barrett, M.S. Kukiara, A.J. Gunetratne, N.S. and Thase, M.E. 2017. A breathing-based meditation intervention for patients with major depressive disorder following inadequate response to antidepressants. A randomized pilot study. The Journal of Clinical Psychiatry. This study investigated the feasibility and efficacy of Sky as an adjunctive treatment for major depressive disorder (MDD) in patients with inadequate response to antidepressants. Significant improvement in depressive and anxiety symptoms was observed after 8 weeks of Sky practice compared to the control group. The findings suggest Sky as a promising adjuvant treatment for MDD patients with incomplete response to antidepressants. Doshi Dias, E. Dobaldini, E. Solbiati, M. Constantino, and G. Sontarenzo, Ardoria, S. and Montana, and 2017. Sudarshan Kriya Yoga improves cardiac autonomic control in patients with anxiety depression orders. Journal of Affective Disorders 214, 74-80. This study assessed the impact of Sky on cardiac autonomic control (CSC) and cardiorespiratory coupling in individuals with anxiety and or depression disorders. Sky significantly reduced depression, anxiety and stress levels while improving cardiovascular coupling, indicating its potential as a non-pharmacological intervention for these disorders. Doria, S. D. Vuono, A. San Lorenzo, R. Irtelli, and Menatti. Anti-anxiety efficacy of Sudarshan Kriya Yoga in general anxiety disorder, a multi-component yoga-based breath intervention program for patients suffering from generalized anxiety disorder with or without comorbidities. Journal of Affective Disorders. This paper explored the efficacy of Sky in alleviating anxiety and depression symptoms in adult outpatients with generalized anxiety disorder. Significant reductions in anxiety and depression scores were observed after 15 days of Sky practice, with sustained improvement over 3 to 6 months. Sky was effective regardless of pharmacotherapy status, suggesting its independent therapeutic benefits. Janakiri Maya, N. Gangadhar, B. N. Murthy, P. N. V. Harish, M. G. Subrakrishna, D. K. and Vedar Murtaka, H. 2000. Antidepressant efficacy of Sudarshan Kriya Yoga Sky in melancholia, randomized comparison with the electroconvulsive therapy (ECT) and Imprimine's Journal of Affective Disorders. In this study, Sky's efficacy in treating melancholic depression was compared with electroconvulsive therapy (ECT) and imipramine. While ECT showed the strongest decrease in depression, Sky demonstrated comparable efficacy to imipramine, indicating its potential as an alternative or adjunctive treatment for depression with potential benefits for relapse prevention. Hamilton West, K. Palat Higgins, T. Sharia. Evaluation of Sudarshan Kriya Yoga Sky-based breath intervention for patients with mild to moderate depression and anxiety disorders. Primary Healthcare Research and Development. This study evaluated the benefits of a Sky-based intervention program for patients with mild to moderate depression and anxiety disorders. Participants showed significantly reduced depression and anxiety scores after the program, suggesting the potential of Sky as a cost-effective therapeutic option for common mental health issues. Janaki Ramaiah, N. Gangadhar, B. N. Murthy, P. J. Harish, M. J. Shetty, K. T. Subrakrishna, D. K. and Vedamurchar, A. Therapeutic effects of Sudarshan Kriya Yoga Sky and dysthymic disorder. NIMHANS Journal. In this study, Sky's therapeutic effects on dysthymic disorder were explored. Sky demonstrated remarkable efficacy in alleviating symptoms with significant remission rates observed at 1 and 3 months post-intervention. The study suggests Sky as a potentially more acceptable and cost-effective alternative to traditional management of dysthymia. Addendum. Decilio, D. Vedamurtachar, A. Garbarg, P. L. Nagaraja, D. Gangadhar, B. N. Damodaran, B. N. Brown, RP 2010. Effects of a yoga breath intervention alone and in combination with an exposure therapy for post-traumatic stress disorder and depression in survivors of the 2004 Southeast Asia tsunami. Acta Psychiatrica. Skandavika. This study examined the effects of a short intervention incorporating SKY on post-traumatic stress disorder (PTSD) and depression in survivors of the 2004 Southeast Asia tsunami. Significant decreases in PTSD and depression symptoms were observed, suggesting SKY as a potentially effective intervention for addressing psychological trauma and mood disorders following mass disasters. Jai Gurudev.